again, I'm Dr. Taylor, the Undergraduate Exercise Science Program Director and Associate Teaching Professor at the University of Kansas. Being able to produce the force necessary to lift a load off the ground in a biomechanically correct manner is important for competitive powerlifters, bodybuilders, athletes, and fitness enthusiasts. Having adequate strength developed to lift loads off the ground is also important for pre-pubescent youth, adolescents, adults, and older adults, not just gym rats or meatheads. People who are stronger tend to remain functionally independent in their older years, and they live longer. So one of the best ways to build total body strength and improve overall muscle mass is by performing conventional deadlifts. So today I will explain the muscle groups activated and the benefits associated with deadlifting. I will also demonstrate and teach you how to properly execute a conventional deadlift. So now let's examine deadlifts in greater detail. So let's talk about the major muscles, the primary movers that are involved in performing the deadlift, the conventional deadlift. So first of all, the knee extensors, right? These are the muscles that extend the knee. During a concentric contraction, we have the quadriceps, which is composed of four muscles, the vastus medialis, vastus intermedius, vastus lateralis, and rectus femoris. The hip extensors, so these muscles extend the hip, right? So like if you're rising up from the couch, standing up, your hip extensors are going to be active. So muscles there include gluteus maximus and the hamstrings, which are composed of the biceps femoris, long head and short head, the semimembranosus and the semitendinosus. Now only the long head of the biceps femoris is going to be involved in hip extension because of where it attaches to the ischial tuberosity, which is kind of that, it's a bump on that kind of loop that hangs down from your pelvis. So these are the muscles involved in hip extension. The trunk extensors and spinal erectors. All right, so the spinal erectors, these are low back muscles that help you to extend the spine, and they're important for posture and obviously the ability to hold your trunk upright. So we have the erector spinae, these are muscles of the low back, quadratus lumborum, it's also in the lower back. And then the last group of muscles we have active during a conventional deadlift are the wrist and hand flexors. So you can feel these muscles contract just by, flexing, contracting and flexing your wrist. All right, so all these muscles, the wrist and hand flexors, are on the anterior aspect of your forearm. Okay, and so, training these muscles, improving strength in all of them is really going to carry over into your ability to perform activities of daily living, being able to obviously pick loads off the ground. Think of an older adult having to pick up a load of laundry, a bag of groceries. Obviously, it's going to be important for athletic performance, a variety of different things. So, all right, so they've done EMG studies, right, where you hook surface electrodes. You put surface electrodes on the skin over various muscle groups to look at muscle activity patterns. And what do you see in these EMG studies if you compare conventional deadlifts to the sumo deadlift? Well, EMG activity is less, meaning less muscle activity of the knee extensors, so of the quadriceps muscle group, during conventional deadlifts versus performing sumo deadlifts, okay? There's an increase in EMG activity seen, however, though, in the trunk extensors, right? The erector spinae, quadratus lumborum, those low back muscles. You have more activity in those muscles when performing conventional deadlifts versus sumo. And part of that is because in a conventional deadlift, the torso and trunk is pitched forward more, versus in a sumo, the reason you see more knee extensor activity is it's almost like you're in a squatted position and the trunk is more vertical. All right, so obviously anatomy varies from one person to the next. So let's talk about how your anatomy can affect your ability to deadlift. All right, so if you naturally have pretty long arms, that's going to be an advantage, more so than having short arms when performing a conventional deadlift. Okay, hip mobility. So if you have an inability to hip hinge, right? So hip hinge is just being able to, again, push your butt back, flex at the hips, right? Maintain a neutral spine. If you have a decreased ability to hip hinge, then conventional deadlifts will be difficult. All right. Hip anatomy. So let's look at the bony anatomy here. The hip anatomy structure will impact your strength and comfort deadlifting. All right, so first let's talk about the angle of inclination of the femoral neck. All right, so your thigh bone here is your femur, and branching off of the femur you have the ball, the femoral head, and a neck attached to it, and that femoral neck and head fits into the acetabulum, which is the socket. Well, that femoral neck can either be more horizontal, like closer to almost a 90-degree angle, maybe 105 degrees. We call that coxa vara when it's more horizontal. Or you can have a femoral neck that's, kind of pitched more vertically, and there's an increased angle between the shaft of the femur and the femoral neck. We call that coxa valga. Okay, with either one of these, coxa vara, you may feel a little more comfortable performing conventional deadlifts. A lot of times people with a coxa valga hip, they can do the splits really easy because of the inclination of the femoral neck, and they can really get their feet out wide, so they may prefer sumo. Next, anteversion versus retroversion of the femoral neck. So what is that? Anteversion is when the femoral neck is twisted forward a bit, and because it's twisted forward, people with an anteverted femoral neck, when you watch them walk, they tend to kind of want to toe in, so they may walk with pigeon toes, and that lends to them being able to perform conventional deadlift. It's going to feel more comfortable than a sumo. Okay, so narrower stance, feet closer together if you have an anteverted femoral neck. Retroversion, so this is where the femoral neck is kind of rotated backward with regard to the shaft of the femur. So you may have seen people walking around kind of duck-footed. That's because with a retroverted femoral neck, you're going to have a greater degree of hip external rotation. And so naturally, it's going to feel better to walk with the toes pointed out, which that would be the setup for the sumo deadlift, which I'll talk about in another video. So again, with an anteverted femoral neck, you're going to feel more comfortable doing conventional deadlifts. With a retroverted femoral neck, sumo is probably going to be more comfortable. Okay. Now, anteversion versus retroversion of the acetabulum. Okay, so what's the acetabulum? That's the socket that the ball or the head of the femur fits into. So the socket of the hip joint, okay? So this can be either pointed forward or backward, right? The socket. If the socket is pointed more forward anteriorly, that's anteversion, okay? If it's pointed more posteriorly backward, that's retroversion. And again, that can impact which deadlift you may choose to perform. If you have an anteverted acetabulum, you're probably going to feel more comfortable performing conventional deadlifts because it's going to allow for a greater degree of internal rotation. It's just going to feel more comfortable with your feet closer together. If you have a retroverted acetabulum, then you're probably going to feel more comfortable doing the sumo deadlift, and conventional may not feel as comfortable. Okay, so let's get into the technique. Discuss, performing a conventional deadlift. All right, so we've got our barbell here. When you approach the barbell, okay, there's a lot of different ways you can teach this. I like to teach starting from the ground up. So let's start with where to place your feet, okay? So approach the barbell, get your feet about hip width apart. So you want them under your hips, all right? Now, when you look down at the barbell should be right over your midfoot, okay? Right over your midfoot, that's important, okay? And you want to keep this barbell as close to your body as possible when you're performing the lift, because the further it gets away from you, it creates more torque and shearing stress on your lumbosacral region, your low back. So again, just keep the barbell as close to your body as possible, okay? About an inch from your shins. That's a good starting point, okay? Now with grip, several different grip techniques you can use. You can use a pronated overhand grip. You can also utilize a hook grip where you wrap your fingers around the bar and then tuck your thumb inside those fingers. So it gives a little more security. There's also an alternated grip that you can use where one palm is facing forward, the other palm is facing backwards. So this palm is supinated, this one's pronated. And what that does is, especially when you get to heavier loads, you know, it helps to lock in the barbell. So if the barbell would start to roll out of this hand, then it rolls into the pronated hand. Only problem is one shoulder is externally rotated, the other is internally rotated, so you kind of don't have that symmetry across the upper back. But anyway, I'm going to show you a deadlift with a pronated grip. All right, so now let's go ahead and perform a conventional deadlift with our overhand, pronated grip. So again, I'm going to approach the bar. I'm looking down. The bar's over my midfoot. Get a little closer to my shins. It's about an inch away. My feet are hip width apart. Now, the conventional deadlift is not a squat, okay? It is a pull. And when you do this lift, you need to think about pushing the floor away from your feet, okay? We're not squatting. This is not a squat. It's a pull, okay? So you've got to be able to hip hinge, okay? And this is where hip mobility plays a factor. And then again, remember arm length. I've got shorter arms, so conventional deadlifts, I don't prefer these as much as I do sumo. But anyway, arm length plays a role. If you have shorter arms, there's going to be more of an acute angle, a decrease in the angle between my torso and my thighs. So I'm going to have to bend over more, right? I'm going to have to hip hinge more, right? So again, right here, when we hip hinge, think of your hips going back, right? I'm just sliding my hands down my legs, and I'm going to grasp the barbell just outside of my shins, okay? Now, we don't want your back looking like this, right? That's lumbar spine flexion. If you're performing the lift with lumbar spine flexion, it's going to increase your risk of things like disc herniations, erector spinae, quadratus lumborum strains. We don't want that. We don't want an injury. So hip hinge, slide your hands down, grab the barbell just outside of your shins, and what we want to see is pack that lower back. You want to tighten it, okay? Pull your shoulder blades together, retract them in the back, okay? And then what you're going to do is pull. Again, think of pushing the floor away from you, rise up, and then when you get to the top of the lift, you want to show a proud chest, okay? And then, again, lower it, back down, slowly, control the eccentric phase, okay? Now, one other thing I want to point out, with breathing, it's good to do a Valsalva maneuver. Hold your breath. So at the beginning of the lift, take an inhalation, hold that breath in, okay? That will help stabilize your spine throughout the lift, all right? And again, just keep you tight. So again, I'll do a couple more. So starting position, feet hip width apart, barbell about an inch from my shins, over the midfoot, slide my hands down, I'm hinging at the hips, right? I'm not squatting, I'm hinging at the hips, okay? Got my lumbar spine neutral. I should feel tightness in those muscles back here, right? It may not feel comfortable, but that's okay, you're in good position, all right? So you'll notice that my shoulders are probably a little bit higher, should be a little bit higher than my hips, and basically my hip joint is between my shoulders and my knees, okay? So, again, take a deep breath. Boom, okay? Slide down. There you have it. I hope this Fitness Facts video helped you understand the conventional deadlift. Thanks for watching.